I think it's important to be realistic about this. Like, even if you are a strong proponent of vaccines in general, seeing something that says there were 140 children as supporting the safety justification for universal vaccination of children doesn't really make a lot of sense today, unless you consider the decades of data we've seen since then. I kind of wish that package inserts would be updated to reflect the breadth and duration of evidence that's been collected in the interim, because it's not easy to find that information. And what's being selectively served to you over social media is, of course, what is most emotionally engaging, not necessarily what is most scientifically accurate.
I think what you're raising is really a very important point that has really an issue with a number of different medical approved products, drugs, or vaccines. And today, there's no reason you can't keep an updated overall library of information that is well beyond that. So yes, you can't give out a 400-page booklet every time you have a product, but you can basically allow someone to go to a website, which didn't exist. Remember when the vaccines first came out, this didn't exist, this technology. I think what you raise is a really good point, and that's the whole purpose of why we did the review we did, because that should be available. And why not put a QR code on the package insert of 1 or 2 pages and let the public go back to the full breadth of the data and let it keep building. I think as new things happen or issues come up, that should be part of that library of information about those. And so I'm glad you raise it. I think it's an important point.